Hey guys, what's up? Good morning. Today, I thought I would come on and talk about a question that I feel like I've been getting a lot as I've been posting more and more on social media. I feel like I keep getting a couple questions, and this is one that keeps popping up. So I thought this would be a really good place to talk about it. And that is, how do you find a good physical therapist or the right physical therapist? Or if you're already working with one, how do you know if they're the right person and you should continue on? And I think it's really important here, especially with hip impingement, because what I have found is that so many physical therapists are great PTs, but when it comes to understanding impingement and labral tears and all that goes into this, if they don't have sort of a trained eye for this, they're not great at helping you with it. And a lot of times it's just because that's not what they're staring at all day long. It's not like this is something, I mean, you learn about it in school, but unless you see a lot of it, you don't always pick up on the smaller movement patterns and like the little nuances in movement that make a really big change and difference. And so for me, somebody who's been really treating this and working, I don't want to say exclusively with this, but a lot, a large percentage of my caseload is with this. Um, you start to pick up on these patterns and things that like you just wouldn't see otherwise. And so what can you do if you're not close by to me, or you like need to find a therapist in your area? How do you know that you're working with somebody who gets it? So there's a few things. I think the biggest thing that you want to first look at is the type of clinic that you're going into, because there are a lot of really great physical therapists out there, but sometimes they don't get to practice as a good therapist because of the system that they're trapped in. And that being, not that all insurance-based clinics are bad. I think it's fine to go to an insurance-based clinic, but you want to make sure that you find one that really prioritizes its patients over and the quality of care of the patients over the volume of patients that they're seeing. If you guys have ever been to PT before, you probably know the story of, gosh, I go in and I see my therapist is seeing 4 other people at once, or I see them for 5 minutes and I get passed off to a tech. With something like impingement and labral tears, where you're trying to change movement patterns, you don't want to be passed off to a tech, because that tech, I guarantee, is not trained in watching how you move and making sure that you're doing the exercises correctly. They are probably just giving you exercises and then letting you go on your way. And that is not skilled physical therapy. Now, if you can find an insurance-based clinic who prioritizes the quality of care that you're getting when you go in there, then it is great to go through insurance. Of course, those clinics are becoming fewer and far between just because of they have to make money somehow. And so that's why they see so many patients at a time, but they still exist out there. You just have to do a little bit of searching. And I suggest, going in and seeing the clinic and sort of how it operates. You can usually go in and just ask to talk to a PT or to like have a little tour or something like that to see sort of how the clinic operates, how busy it is, and try to find somewhere that you can get at least a portion of your time that's going to be one-on-one with the therapist. I think it's totally fine to call and ask if that's something that you would get in a place in that clinic. Is it one-on-one time, and how much one-on-one time would you get? I don't think the entire visit needs to be one-on-one if you're in that model, but I would say a large portion of it does. And then more importantly, somebody needs to be keeping their eye on you. If it's going to be a clinic where they give you exercises and then you go do them on your own, that's just not going to work here. We know that hip impingement is a movement-based issue. And so you have to know how to correct these movement patterns in order to make lifelong changes instead of just the quick short-term fixes. So that kind of brings me into the next point, that when you're looking for a PT, you want to, I would almost interview them in a sense of, do they have experience treating hip impingement non-surgically, or if you've had surgery, like what's their surgery, are they used to treating it post-surgical rehab as well? But find out if they have any experience treating it and how much experience they have. I don't think there's anything wrong with asking that. I think as far as like what their treatment methods are, every therapist is going to differ in how they do things, and that's a good thing. Not every physical therapist should be exactly the same. We don't want clones of everybody. It's good to get some changes and differences in how people treat, However, there are a few key things that you should be getting out of your therapist across the board. The first is your PT should be always explaining what is going on. They should be able to explain what's happening in your body, what the diagnosis is, what that means in real life instead of just like big fancy medical words, what your images might be meaning, again, explaining them in a way that's not so scary. They should be able to explain pretty much every exercise and intervention that they give you. They should be explaining what it is for. Because if you don't understand what you're being given and why it's being given to you, it's a little bit harder to sometimes stay motivated and stay on track with the exercises because you just don't see and you don't correlate it to why is this going to make me, run better, right? If you go in and you're like, I have impingement and I want to be able to run, and they're giving you hip bridges and those hip bridges feel really easy to you, they might still be the right exercise and the therapist might have a method behind what they're doing. But if they don't communicate that to you and they don't explain why you have to do this first before you transition over into single leg bridges, before you transition over into standing, before we add impact, and then we go back to running, if they can't lay that out for you, then number one, ask them to. And then if they still can't lay that out for you, then you're probably not in the right place. Your therapist should always be able to explain your plan to you, what's happening, and they should be communicating that freely. You shouldn't have to pull that out of them. I know sometimes we get busy and it's easy, I think, sometimes too, to just think that, oh, I've already told that to a patient, they probably remember. Well, not really, right? Like, you're not going to remember visit to visit. You need to hear the same things over and over and over again. So that PT should understand that and should be communicating that to you. So step one would be, if you are working with a PT, ask them to do that. Like, hey, can you explain, like, I don't understand how any of this is tied together. And if then they're still not forthcoming with that information, or they can't actually give a reason that, or it doesn't make sense to you, then that's probably a bit of a red flag and probably a sign to move on. When I'm working with my clients in the clinic, I make sure that every day that they walk in, they have a clear understanding of what we're going to do for the day, a little bit of a recap maybe of what we've been doing up to this point. Now we're at this phase. Here's what we're going to do for the day. Here's why we're going to do it. And now I always then try to make sure, okay, let's tie that into some sort of functional activity, whatever your goals are. I want to make sure that there's a very clear correlation for my patients between activities that we're doing and their goals. So every single time I'm making that connection. It may not be with every single exercise every time, but the theme of the visit for sure is always going to be tied back to, hey, we're getting this back so you can take impact so you can run again, or whatever it is. And then before they walk out the door, I am making sure they understand, okay, here's where you're at. Here's what we went over today. Here's what we're going to go over next time. And maybe sometimes I explain it even beyond that, right? Like, next time we're going to do this, then we're going to add the impact, then we're going to do your return to run. So we're getting really close. We're almost there, but like, here's the steps we still have to get before you go do that. That's going to make you as the patient understand why you're not supposed to walk out the door and go run 5 miles, right? How many times does that happen where you're like, I'm just going to go do it because they're telling me I need to be stronger. They're telling me I need to do things, but they've never given me a path how to do it. So I'm just going to go do it. And then you end up flared up again. Well, if your PT would have given you the path and they would have laid it out for you, it would make so much more sense of like, nope, she said I can't go run until I can do XYZ. So I'm going to go work on XYZ because I want to run again. So I think, these are the things that your therapist should be doing. They should be doing without you asking. It unfortunately, I think, is a bit more uncommon to find PTs that are doing that, but they are out there. You just need to find them. So interview people, ask around, feel free to ask me. If you're not local to me, chances are I probably have a connection somewhere, or can at least point you in the right direction of where you could look. So please reach out if you have any questions. And I hope you guys know too, I do work with clients virtually. So if you can't find somebody in your area, coaching is a really great option virtually to help you through some of the things that you might not be getting in your actual in-person physical therapy. So I hope that that's helpful. Let me know, comment below if you guys have questions, comments, any good experiences you've had, bad experiences you've had. People love to share their horror stories, but I'd love to hear it all. So share away in the comments, DM me if you need to, and hopefully I will talk to you guys all again really soon. I hope you have a great day.